With so much going on right now, where do you start? We could talk about our rapid descent into totalitarianism. We could talk about the village idiot spreading misinformation again. Measles has killed tens of thousands of New Zealanders since the 19th century, with epidemics every few years until vaccines became available. Really, Helen? What does the Ministry of Health and other government departments say in their data about this? You're telling porkies again, Helen. Can somebody put a few masks on Helen, please? We could actually talk about masks. We could also talk about being a good citizen and queuing for hours to have the base of your brain inappropriately fondled. Remember when Mike Hosking the other week called out Comrade Ardern for not having a COVID swab? And the next day she threw Dr. Limp Handshake kind of guy under a bus again and sent him off for a staged swab. The Ministry of Health later on released a few lovely pictures of Ashley getting shafted. Well, I want you to note the angle the stick is on. Now, watch this video from the New England Journal of Medicine, one of the most prestigious medical publications on the planet, except if anyone publishes something that goes against corporate interests.
Have the patient blow her nose into a tissue to clear excess secretions from the nasal passages. Tilt the patient's head back slightly so that the nasal passages become more accessible. Instruct the patient to close her eyes to lessen the mild discomfort of the procedure. Gently insert the swab along the nasal septum just above the floor of the nasal passage to the nasopharynx until resistance is felt.
Note the angle of the swab. Or how about this from a doctor?
Hi everyone, how are you doing? This is Dr. Hashim Jamal. I'm an ENT consultant at Burjeel Day Surgery Center. Okay, so we will start with the nasopharyngeal swab. It's very important to know that the direction of the nasopharynx goes this way and not up, not this way. It's very important. That's why when we want to direct our Q-tip or a cotton bud, we have to direct it to the nasopharynx all the way to the back. So this is the Q-tip for the specimen taking, and the direction has to be, I'm privileged to be having a nasal speculum. Nasal speculum will allow me to see the front of the septum, and then the floor of the nose, and this swab should be going right along the nasal septum, along the floor, all the way to the back. You turn it when you hit the nasopharynx. You turn it for to get a better sample, and then you go out. This is the proper way of doing it. If you go in and then you go this way up, for example, like this, improper way. If I go like this up, it's improper. It's not good. Therefore, the direction is all the way to the back.
Just a PR stunt, wasn't it, Ashley? I wonder how many other tests are being performed incorrectly in a supermarket car park. Certainly the most hygienic place you want to do tests for a virus that the media are telling us is going to wipe us all out. You see, there's more than a few problems with this PCR swab that everyone has been sheepishly lining up for. It was mentioned this week on Breakfast when Jenny May interviewed Dr. Anush Adalja. His work is focused on emerging infectious diseases, pandemic preparedness, and biosecurity. Now, this interview was on the highly respectable and seeker of truth station, TVNZ. So it can't be misinformation. The good doctor works for Johns Hopkins, and they're all snuggly with Bill Gates' wallet. So what Dr. Adalja said to Jenny May is not a conspiracy theory. So what did he say about the PCR swab as a way of getting tested for CV?
Now, I want to talk to you about the international modelling of the virus and what that tells us about what's to come. But first of all, I see that from your published material online about testing, and here in New Zealand, there's been some discrepancy around the testing of frontline staff. And I want to ask you about that in a second. But first of all, how important is testing as a strategy?
It's very important. It's kind of the keystone to a strategy because you have to be able to answer the fundamental question, who is infected and who is not? And countries that have done well at controlling this have been really adept at testing. If you look at places like Taiwan, places like South Korea, which early on were very aggressive with testing, they got their outbreaks under control. And in the United States, we've been struggling with testing since January, and we're still struggling now in August. And you can see the trajectory our outbreak has taken because we simply cannot get tests done quick enough for them to be actionable, for contact tracers to be able to start investigations. So testing has to be part of how we move forward in this pandemic, and we have to solve this.
As I said, there's been some discrepancy here in New Zealand around the testing of frontline staff. So what would your direction around border testing be based on the science and the numbers? Should everyone working on the front line be tested? And if so, how often?
So I don't think we need to test people who don't have symptoms unless they're part of a case contact investigation or they're going in maybe for a surgery and you want to...
We don't need to test people who have no symptoms. Then why are they lining up for hours? Are they all sick or just being consumed by fear?
To screen them to make sure that they don't harbor the virus. The tests that we use now are primarily PCR tests, which are very sensitive, and we don't actually know what that PCR test positivity means in someone who's asymptomatic. Are they someone who was sick before and are shedding the virus? Are they someone that's infectious?
Sorry, what was that?
The tests that we use now are primarily PCR tests, which are very sensitive, and we don't actually know what that PCR test positivity means in someone who's asymptomatic. Are they someone who was sick before and are shedding the virus? Are they someone that's infectious?
They don't know what the positive reading means in someone who shows no symptoms. What? Listen to that again.
And we don't actually know what that PCR test positivity means in someone who's asymptomatic.
They don't know if you're infectious. You've tested positive, but they have no clue you're infectious. You've tested positive and will be placed in management quarantine. And they have no idea if you're infectious or not.
Talk to me about contagiousness tests and how that could be effective.
So when we get a PCR test, we don't know whether or not that means you're infectious. Clearly, if you have symptoms, you probably are infectious. But if you are somebody that's completely asymptomatic and you go and get tested, does that mean that you are actually infectious? Or is that just viral remnants that might have been there because you were sick maybe 2 weeks ago and you had mild symptoms and you didn't know it and you're somebody who constantly sheds? So there
viral remnants from a previous illness?
Clearly, if you have symptoms, you probably are infectious. But if you are somebody that's completely asymptomatic and you go and get tested, does that mean that you are actually infectious? Or is that just viral remnants that might have been there because you were sick maybe 2 weeks ago and you had mild symptoms and you didn't know it and you're somebody who constantly sheds? So
coming out of winter, how many people are testing positive for a cold they had a few weeks ago and thought nothing of it? But with a 99.6.7% global survival rate? For a virus that the media and the government are telling us is going to kill us all.
There is this effort underway to try and develop a less sensitive test, meaning it doesn't necessarily pick up every person's viral load if it's very, very low, but it picks up the levels that are correlated with being infectious. So if you do this test and it's positive, it means you're more likely to spread this to somebody else than someone with a PCR test where we don't really know what the threshold is for someone being infectious. And this can be done cheaper using technology that's non-PCR based and done rapidly and simply. So this is something that we're hearing talked about in the United States. There was a big article in the New York Times as well as in the Atlantic that have been trying to promote this strategy, and it's something we're all talking about. And it might be a way that we move forward, because if at home you could know your status instantly, whether or not you're infectious to others with a paper test that you take at home, then you could do things in a whole different manner.
So someone who specializes in emerging infectious diseases, pandemic preparedness, and biosecurity, with an organization that is in bed with Bill, and Bill's a great fan of Jacinda, you'd think she would have got the memo. Our cases are going to rise and increase in people getting tested, simply because the test picks up everything, even the previous viral load. Even the Chinese stopped counting people as confirmed cases when they test positive for a virus, but show no symptoms of the disease. And given Labour and National's love affair with the CCP, you think they would have shared that little idea with New Zealand. But hey, Let's just lock down people's lives for 4 cases and their contacts, who may not even be sick. It's not important for the public to know. Why hasn't Ashley Blumfeld or Mr. Brainfart Michael Baker explained this to you? How was it that we heard this from one of the participants of the Coronavirus Preparedness Event 201 that happened months before the rest of the world even knew it existed? And by the way, cases are an insignificant number, unless you want to look at the cancer, diabetes, heart disease, mental health, autoimmune cases every day at 1 p.m. Dr. Ramesh Adalja explained in detail a positive PCR is not a case. It's an unscientific bunny trail. This is why they're looking at a very cheap paper strip which tells you whether or not you are actually a case, rather than a hoarder of past viral remnants yet to be shed. Instead of promoting a problematic test which tells us very little, Ashley should be telling us about the number of COVID hospitalizations, people needing ICU, and the tiny number of real deaths directly resulting from COVID infection. We shouldn't be regaled with fake deaths because a person died of old age, but had a PCR test which picked up viral fragments which had nothing to do with their death. When added up today, the real numbers would not justify any level of imprisonment or dismantling of businesses. And the government knows this, unless they need to find some way of sticking to a plan.
These issues in New Zealand, the government I'm proud to lead is doing something not many other countries have tried. We've incorporated the principles of the 2030 Agenda into our domestic policy making in a way that we hope will drive system-level actions.
And have chosen to lie, cheat, to convince everyone to get Bill Gates' vaccine.
Of this legislation is making sure it is future-proofed, that this is a rapidly evolving global situation. It could, in the future, include the requirement that someone is vaccinated.
Wonder what other surprise the government has for us. Good luck with that vaccine.